Dengue is very difficult to distinguish clinically from other infections which may also be endemic in these regions, for example, influenza, Zika, chikungunya virus, or even malaria. Therefore, to make a diagnosis, laboratory tests are required. Dengue is diagnosed by looking for the virus itself in blood and/or urine, with the greatest yield from blood in the first 5 days of symptoms. Serology, which is where we measure the antibody response to the dengue virus, can also be used to confirm the diagnosis. We also take other blood tests, for example a full blood count, renal and liver function, to help us exclude other infections, diagnose dengue and assess for complications. Most infections with dengue are self-limiting, i.e. will recover without medical intervention. In fact, there are no specific treatments for dengue, only supportive treatments to manage the symptoms and complications of infection. It is important to ensure that you remain hydrated. Paracetamol can be taken for pain relief or to help lower the fever. However, non-steroidal anti-inflammatory drugs, also known as NSAIDs, for example ibuprofen, Nurofen, naproxen, should be avoided, as these may increase the risk of bleeding. Fever in a returning traveller should always be assessed by a medical professional. Most returning travellers with suspected dengue infection can be managed at home and do not need to be admitted to hospital. However, this decision will depend on the clinical assessment.